Hi guys, Dr. Brown here. Just going to talk a little bit about shoulders, common injuries and what we can do to help. The shoulder is the most mobile joint in the body and it comes at a price of stability, so it is easy to injure the shoulder area. One thing that helps to injure it, or makes it easier to injure, is when the shoulders roll forward and sit in that position. With a shoulder that comes in forward like this, with the head that comes forward as well, and then you add overhead work to that, it's very easy to pinch, in particular, this supraspinatus muscle that sits up the top here, the most commonly injured muscle. And that pinching will create inflammation. If it keeps happening, it'll just swell up and then you've got your sore shoulder. So one thing you can do to help with that is to have the shoulders roll back and open up. It's kind of popping up the sternum and the chest up and out. Let that shoulder sit back. It opens up the space between the top rib and the clavicle or the collarbone here. So that opens up that space for the tendon which goes through. If it's pinching by having that roll position, it's more likely to get inflamed. The other thing to do while it is inflamed is to rest from overhead work. So, because the second you do that, again, you pinch it up even more, press the bones against the tendon. If you can refrain from that for a little while, for a week or two, you can do this, but the second that joint goes above 90, that's when you're starting to pinch it off again. So relative rest there to help. Sitting it back, having the head come up and back to, again, open all that space. A little exercise you can do at home is to have yourself kind of just leaning up against something and then let one arm just dangle and do little circles and then little figure of eights, something like that. That is a nice, simple approach to basically the first step of rehabbing a shoulder that's been injured, especially one that's really acute and really painful. Eventually you can add weight to it, so you can be holding a dumbbell or a bag of shopping or something like that, and you can again do small circles just to help create traction and to create then movement in there to help open that up a bit. Any questions? Come and give us a call, pop in and we'll have a look. And other than that, have an awesome day. See you soon.